So I just want to welcome everyone that's joining us today. My name is Leanne Kramer. I am a patient advocate, and we are going to do an interview today with medical oncologist Dr. Nancy Lynn. And before I formally introduce her, I'm going to read her bio to you. Dr. Lynn is a medical oncologist specializing in the care of patients with all stages of breast cancer. Her research focuses upon improving the outcomes of people living with metastatic breast cancer, including a particular focus on the challenge of breast cancer brain metastasis. She has led multiple clinical trials, which have led to new treatment options for patients with breast cancer that has metastasized to the brain. Dr. Lynn received her MD from Harvard Medical School in 1999. She completed her residency in internal medicine at Brigham and Women's Hospital and went on to complete fellowships in medical oncology and hematology at Dana-Farber. In 2005, she joined the staff of Brigham and Women's and Dana-Farber, where she is medical oncologist and clinical investigator in the Breast Oncology Center. So it's wonderful to have you join us.
Thank you for having me, Leanne.
Of course. For those who probably don't know, Dr. Lynn is actually my oncologist, and she is wonderful and does specialize in the treatment of brain metastasis. But you treat, as your bio mentioned, all stages of breast cancer. Can you tell me a little bit about your role as a medical oncologist, what you do?
Yeah, so as a medical oncologist, our focus is on basically the sort of medicine-based treatments for breast cancer, whether early stage breast cancer or metastatic breast cancer. And so those medicine-based approaches can be medicines like hormonal therapy, chemotherapy, or targeted therapy. And in general, except for the initial part of therapy, where often the breast surgeon is the so-called quarterback, for much of the rest of the course of treatment, and certainly in patients with metastatic breast cancer, in general, the medical oncologist serves as the sort of quarterback of the team.
So after early stage treatment ends or with a diagnosis that begins with metastatic breast cancer, can you talk a little bit about what happens with metastatic breast cancer?
Right. So with metastatic breast cancer, our goals are to try to help people live the longest and best quality of life possible. And we do that really in cooperation or collaboration with the patient, usually going from one treatment to another in hopes that each treatment will work for a good period of time and that we can string out one treatment after another to allow people to live long lives in many cases, although not all cases, even with a diagnosis of metastatic disease.
So early stage, there's a curative intent where with metastatic breast cancer, it is spread beyond the breast. And at that point, the intent is to provide care that can extend a life. And
That's right. So in general, for metastatic breast cancer, and never say never, but in general, what our goals are not so much to cure the cancer, but to really keep the cancer under control for as long as possible so that people can, experience sometimes extended survival even in the setting of metastatic disease.